Good evening. Welcome. Thank you everyone for joining us to learn about the exciting world of insurance. We're happy to have you with us. A few details before we begin. I just wanted to tell you about our team. The Student Insurance Office is located on the 3rd floor of John Jay Hall, and we are on the Morningside campus, in case you don't know where John Jay is. It's in the corner of 114th and Amsterdam. We are here on Monday through Fridays from 9 to 5 with designated drop-in hours that we keep posted on our website. The team is here to assist you in answering questions, offering direction, assisting you basically with anything related to insurance, whether it's the student plan or your own plan. We are here for you. We have 5 amazing members on our team, and with me today I have Cynthia Razzo, who is the insurance specialist for both Morningside and Teachers College. And with that, we would like to move into giving you an understanding of your insurance and how you're going to use it. So a few things posted here of what we're going to be talking about today. Let's be honest, there is no argument. Insurance in general can be complicated. It can be hard to understand. In the United States, I think it's even more confusing than most places. And we're here to help you not only understand your plan, but we want you to learn how to make the most of it, to understand the key insurance terms, what to do to avoid unnecessary expenses, and to take that knowledge with you beyond Columbia University. The ability to not only navigate, but to advocate for yourself in the often complicated and confusing world of insurance. So with that, we're going to get into a few insurance basics. The type of plan that the Aetna Student Health Plan is what we call an open choice PPO. This means that you're able to select your own providers within the Aetna network, or if you choose to pick your own provider that's not partnered with Aetna, you can have that care, but you are going to be charged a greater amount, and we're going to get into that in a little bit. The Columbia plan is what we call a platinum level plan. It offers students one of the richest and most comprehensive plans that's available on the market today. The price, sometimes you look at that and you're like, wow, that is an awful lot for insurance. And yes, every dollar counts, but the plan itself is nearly 1/4 of what the usual individual would pay if they sought out this plan on their own. So it is incredibly comprehensive. It offers amazing coverage when and if you do need to use the plan. If you have a medical concern, or you simply want to establish a baseline of care while you're here at Columbia, you're going to make an appointment with medical services. You're going to consult with a provider. You can do this by going to the patient portal and requesting an appointment. Later on, you're going to see a quick card that has actually the add or how to get to the portal and also the phone number for medical services if you need one-on-one help. If you do not have a doctor already, you can request a specific team member or be assigned to a primary care physician. It's important to complete your medical history. If you have any existing conditions, I'd say it's even more important because this helps in the assignment and being able to provide the best match of providers for you to ensure the best care. If you do not have the Aetna Student Health Plan, that's okay. We'll still help you. You can still access medical services for care if you do, in fact, have a full-time health and related service fee. You can access counseling and psychological services. But if you just have your plan and you're part-time, you can still have access to 80 programs and services that are provided to students through Columbia Health. So good thing to know that beyond your medical insurance, you have so many resources here on campus. Your care does, however, start at medical services. routine, urgent, medical care, travel services. Medical services is located also in John Jay Hall. They are on the 4th floor, and their services include everything that's listed here, and it's a must stop for obtaining a referral if you are on the Aetna Student Health Plan. Full-time students will have full access to medical services. Part-time, half-time students with visa status, you will also have full access. If you are neither of those, but you want full access, you can actually speak to us about upgrading your health and related service fee. Medical services is your first stop to care. It's a first stop for students when anything doesn't seem right. If you wake up and you have an awful abdominal pains that you can't get rid of, if you have a sore throat and you feel like you're getting strep or COVID or what have you, go to medical services. They are here to assist. You do not need to pay a copayment, so that does save you money going off campus. It also saves you from having to find somebody. But most importantly, if you're on the Aetna Student Health, it saves you from a penalty by going off campus first without a referral. We'll get into the referral aspect soon as well. Telehealth is available. There's 24/7 assistance. On campus, there's also emergency medical services for true emergency services. And on campus, there's no additional charge for that for students. Medical services also offers care. There's care provided from the PCP, the primary care physician, but also there's a tremendous staff of nurse practitioners, medical assistants, and health service associates and caseworkers. So whatever your issue is, remember that medical services is here to assist you and guide you and treat you. The Columbia University Student Health Insurance Plan, as I mentioned, is an Aetna Open Choice PPO. The plan year runs from August 15th, 2024 through August 14th of 2025. A referral, which is basically a permission slip to seek care off campus, needs to be provided from on-campus medical services before you go see a specialist off campus. And the referral needs to be obtained from either your primary care physician at medical services, or if it's a mental health referral, from CPS, Counseling and Psychological Services in Lerner Hall. So what is a referral? Like I mentioned, it's a permission slip. It ensures that you are directed to the proper specialist. It's so you're not self-diagnosing. It's a way to make sure you're seeking the proper specialist and not just picking up the phone and going to see someone random. It's making sure that you're going to the qualified specialist for the right specialty. So it is not to make your life challenging. It is to ensure that actually you have a much smoother experience while you're here. So a little FYI, medical referrals need to be renewed annually. The plan year, as I mentioned, goes from August 15th to August 14th of the following year. If you have a referral that is written by your medical service primary care physician, and it's written after July 15th of the upcoming plan year, that will be valid through August 14th of the following year. Your medical referral needs to be updated and renewed annually. Oftentimes, you can just send a secure message to your provider. Other times, depending on the condition, they will ask you to come in for your annual visit to make sure everything is still in order. But no matter what, most times when you're going off campus, you are going to need that referral, or you will receive a non-referral penalty, which will cost you far more when your claim is processed through, starting with an out-of-network penalty of a $600 deductible. The CPS referral, Counseling and Psychological Services, as long as you remain on the Aetna Student Health Plan continually with no service break, you will not need to renew that referral for the length of the time that you continue on the plan. If you visit urgent care or you go to the ER, one thing you need to make sure is that you return to medical services either physically with an appointment or you reach out to them by phone or secure message to get a referral for related follow-up care. If you're in the emergency room and they say, okay, we ran all these tests, now you need to go for follow-up care, we wrote you a referral to go, please remember that referral is not valid. It's okay for them to write it, but it's not valid in the eyes of Aetna Student Health because it needs to come from medical services. You don't need a referral to go to the ER or to urgent care, but you need one if you're going in between back to follow-up. So if you have follow-up care after one of those visits, please make sure you get a referral. Another thing to mention on referrals is if you are more than 50 miles away from campus, you do not need a referral. So if you are traveling, if you go back home, you need to seek care, you do not need a referral if it's more than 50 miles away. So now that I've given you the basics, we're going to dive in a little bit deeper as to how to get started using the basics and moving forward in the insurance. So getting started, I think we agree, and I mentioned before, insurance does seem more complicated than it really is. By participating in workshops such as this is a great start, and it's a great way to learn your basics. We also offer monthly insurance workshops. They're about 20 minutes, half-hour max. There's usually 10 minutes of Q&A afterwards. They're on different subject matters. If you get onto one of those workshops and 5 minutes in, you're like, this is not the subject I wanted to hear about, then get off, but then get on the next one. Because by exploring the workshops, you will start to better understand your insurance. And again, it's 20 minutes. If you can listen to it on your walk across campus, maybe that would be helpful. Watch for the monthly emails that come out. If you're on the Aetna plan, they usually have details. There's links to click. If you're not sure where to get your ID card, you can find it there. I'm going to get into these keywords that'll help you jump off on the basics, but most importantly, ask for help. If you don't understand something, if you're not sure what the next step is, if you get a bill that doesn't seem right, don't panic. Don't worry about it. Don't stuff it in the drawer. Ask for help. Send us an email, come into the office. We are happy to walk you through it. So I am going to give you kind of a quick overview of key terms and how they apply to the insurance plan related to insurance usage. So some of the most common words, I have mentioned a few of them. There are a couple others that are going to look a little new, but a premium. A premium is the amount you pay to be able to participate in the insurance. So if you see a statement on if you see a bill in your student statement that says, I believe it's under MED, if it's medical, if it's health or what have you, if you're on the Morningside campus, you're looking at $1,888. That is your premium for the fall semester. That is the amount you pay to be eligible to use and participate in the Aetna network. Aetna is the provider and they partner with the doctors who make up the network, and your premium is like your cost to utilize it, almost like your membership to a gym. A copayment is what you pay when you go to your specialist off campus. Most times it's $30. If it is a mental health off-campus visit, it is $20. If it is your first 10 visits off campus for mental health, then it would be $0. But your copayment is what is expected at the point of service before the doctor sees you. So you should bring that payment with you because it's not billed. It's usually asked of you at the time before you're seen. So it's like going to the gym to pay $45 for a Pilates class. Coinsurance is a little more complicated. That is if you have multiple providers who are factoring into the billing. So let's say it's for you're in the hospital and you have to have surgery, you have an anesthesiologist, you have a surgeon, you have another specialist, you have the nursing staff, you have use of the hospital room. All those things, including your $15 Tylenol tab, is going to be rolled into one. They'll break it out, but basically it goes into what is a coinsurance component, where if you're in network, it would be 10% of the total cost. So it's cost sharing because then Aetna would pick up 90% of the in-network total cost. You do not have a deductible in network. The deductible applies out of network. And that means if you go out of network, the first $600 that you are billed will be on you before the insurance starts to kick in. I know these are a lot, but if you can remember just a couple of them, I think copayment is probably your most important of that list, not to take away from the rest. But I'm going to move up a little further into it and get into what your PCP is, because I mentioned that multiple times. PCP is primary care physician. It's also known as your general practitioner. It could be, you could think of it as your family doctor or your main doctor. It's the person you go to first. So it's your person where you go for your annual exam. It's the person who's going to check out your ear if you think you have an ear infection. If you've got a rash and you think you might need a dermatologist, you're going to that general practitioner, PCP, primary care physician at Columbia, found in medical services. They will write you the referral, which is your permission slip to go off campus. You will find a provider who hopefully is in network meaning they're participating in the network that has contracted with Aetna at negotiated rates. If you go out of network, that means there's no negotiated rate. The doctor can charge whatever they want. Aetna will reimburse you up to, they'll reimburse, you're on the hook for 40%, so they will reimburse 60%. But if the doctor charges more than the reasonable and customary Medicaid amount, you would be responsible for anything additional also. So lots of financial reasons to stay in network, on top of the fact that we're in New York City, where the network is pretty vast and you should be able to find care fairly accessible. You can also find care internationally because Aetna covers you 24/7 wherever you go. So I'm going to do a very quick synopsis here before I give you over to Cynthia, so you have a new voice coming in. Columbia Aetna Student Health Plan. I think I kind of went over most of this, so I'm just going to touch upon what I know I did not speak to. There is a $60 copayment for urgent care. Urgent care, if you sprain your ankle and it's swelling and you can't get into medical services, but it's not really worthy of an ER visit, go to urgent care so they can take care of it and advise you whether you need x-rays or not. If you know that you dislocated something seriously, if you know that you are just not feeling like you're going to make it to the next day and it's very urgent, get to the emergency room. It's $150 copay for the emergency room visit, but if you happen to be admitted, that's going to go into your overall cost. It's not going to be, they're not going to keep that charge for you. Ambulance transport. If you are not on campus and cannot utilize the zero cost EMS, if you're 30 blocks away from campus, ambulance transport has gone down. It's now $50 for the transport service as opposed to $100. A lot of information. It probably sounds worse than it is if you take it in digestible amounts. but hopefully broken down, it seems a little bit more manageable for you. And with that, I'm going to give you over to Cynthia Razzo, who's going to speak to you about claims and waivers and some more fun things.
Thank you, Karen. So we are going to go over what happens after you've received your referral and visit the in-network specialist. So this is going to cover claims. So once you're seen by the physician, you may have already paid your copay. But if you have a procedure or diagnostic test, you may also owe the coinsurance that we talked about earlier. So what happens now? Your in-network provider will file the claim directly to Aetna. So Aetna will process and pay their portion to that provider. After that, they'll send you something called an explanation of benefits, or commonly known as EOB, which outlines the services that you had, how much they paid, and how much you may owe. What's important to know is that an EOB is not a bill. It will literally state on top, this is not a bill. It's an explanation of a claim that was processed in your name. After that, the provider's office or the hospital or whatever facility you went to will send you the bill directly. And that's who you pay. So most of them have a portal or some way that you can pay electronically. You can go in the office and pay the rest of the amount that you owe. If you only owed a copay, that's it, you're done. Your total should be $0. If you do go out of network, generally you will have to pay out of pocket, either there at the point of service, or they will bill you the entire amount, and then you have to submit the claim through Aetna. They have a website where you can upload your receipts and all of that, and you'll get reimbursed according to your benefits. Okay, so that's the claims. We're going to move on to open enrollment. We'll go to the next slide. We're talking about what is open enrollment and why is it important. So open enrollment is a time of year where you can make your insurance selection to enroll or waive. You're going to hear this phrase as you leave Columbia, and if you're offered employer-sponsored insurance. Open enrollment happens every year. Columbia's open enrollment is from July 15th, and it runs through September 30th. So we have 5 days left. All full-time domestic students, which are permanent residents and citizens, and all visa holders need to take action. The insurance plan year started back on August 15th and remains active as long as you're registered for spring. So that will continue through August 14th of 2025. So that's even if you graduate, or if you take summer classes or not. The only other way you can enroll or drop during outside of the open enrollment period is if you obtain qualifying coverage or you lose the coverage that you had. That is considered a qualifying life event or a QLE, and we have a separate process for that. Okay, how do you take action? You're going to enroll or waive through the patient portal. Like I said, the open enrollment period is going to end very soon, September 30th. If you have not taken action yet, then you will be enrolled in the plan automatically. So we always recommend that you take action prior to this so that we can activate your coverage if you are enrolled. Otherwise, your coverage won't start till October. It'll go back to August, but you won't be able to use it till October. So we do recommend, if you haven't taken action yet, go ahead and do so now. If you intend to waive, you also want to do that soon because you want that insurance premium taken off of your student account. Gail has gone ahead and entered the link for the patient portal in case you need it. So how do I know I successfully enrolled? Once completed, you'll see a pop-up before exiting the system stating that your enrollment request was successful. And then in your patient portal, you're going to scroll down to insurance enrollment, and it should say compliant next to it. About a week after you do this, you should be receiving an email from our office telling you, welcome to the plan. It'll give you a little synopsis of how to use the plan. We'll remind you of how that you need a referral and where you can go to get your ID, which we're going to get to next. So once you are registered for classes, which hopefully you all are by now, once you have confirmed your enrollment in the patient portal, and once you are billed tuition, your insurance will become active. Like we mentioned, the plan year began August 15th, and once you are activated, your ID card is available to you digitally on the Aetna website. So you download the card, you go to aetnastudenthealth.com, you select Columbia, you put in your uni, your date of birth, and your insurance card will pop up. You can save a copy. You can also download their app, sign up for an account there, and you will have it on your phone. You can get a physical card if you'd like a card to have in your wallet. You just need to call Aetna, which is the number will be on the backside of that digital card, and they will mail you one. We talked about waivers as well. So we do have waiver requirements that all students must meet if they want to waive the insurance. So domestic students and visa holders such as F1, H1 are eligible to waive if you have a plan that meets university's requirements. Please note for 2024-2025 that J1 students are not eligible for waivers. The requirements are available on our website, including a very handy checklist where you can see if your potential plan meets the university's requirements. We do a manually review every single waiver request that comes in, and it's not an automatic process. So if a plan does not meet the university's requirements, we will deny the waiver. And then all documents need to be submitted in order to review the waiver. Any statuses can be found on the patient portal in the waiver section. To continue that, we do have a medical evacuation and repatriation, which is required for all visa holders, anyone who is not a U.S. citizen or permanent resident. You can read the requirements here. Basically, the minimum coverage requirements of $50,000 for medical evacuation and $25,000 for repatriation. It should be valid until the end of the plan year, and you must submit documents that detail the dates and the coverage amounts. The Aetna Student Health Plan does cover this, so if you intend to waive, your plan must also cover the medical evacuation and repatriation. So once you're on the plan, here's a few enhancements that we have added this year, or Aetna has added this year. We're going to go over some, which we kind of talked about before. So there is a mail order pharmacy now available for 90-day prescriptions. There are certain ones that are eligible for this, and it's very important to make sure that you remember to update your address when you're utilizing the service, because we want to make sure that it gets to you if you're at home or if you're on campus in New York. Aetna, CVS, Caremark are able to send your prescription medications to the correct address. There are approximately 80 generic medications that are available to you with prescription, of course, for $0 copay. So this is a new thing. There is a link that we could I'll put in the chat right now. It's a PDF. It'll give you the list of medications that are available to you. Again, at $0. Ambulance transport has been reduced from $100 to $50. Karen mentioned it earlier. If you're not on campus, you would call 911, go to the hospital. The ambulance transport copay has been reduced in half, so that's $50. If you are on campus, Columbia University has an EMS that will be no cost to you. Off-campus mental health services. So this was added last year and it's been continued this year. Karen mentioned it a little bit. So if you receive a referral from CPS, from Counseling Psychological Services, for off-campus mental health care, your first 10 billed visits will have a $0 copay, as long as you visit that in-network provider. And then after the first 10, your regular $20 copay will apply. And then just always remember that your on-campus CPS visits are covered under your health fees, so they are no additional cost. These quick guide cards, these are small business side cards. They're available around campus. We have them in the insurance office. They're available in the doctor's offices at medical services. Individual schools have them. We carry them during tabling events. So most of the information that we talked about today is listed here. There's important websites, phone numbers. If you look here, medical services, under medical services, it has the patient portal link that you can go to make appointments. It reminds you that you need referrals. And then our email is on here as well, studentinsurance@columbia.edu. The phone numbers are there. If you want to take a screenshot of this, these are very important information to have. If you get the physical card, you can hang it up. Just have this information handy. So we know we're telling you a lot of information, but here it is in a quick little guide for you. All right, I'm going to send it back over to Gail for the wrap up.
Thank you so much, Cynthia and Karen. That was really incredible information. And thank you all for sticking with us for all of this really important details to know about your care at Columbia University and how Columbia Health works with the Columbia Student Health Insurance Plan. So just to reiterate what my colleagues have already said, if you have not already done so, please either submit a waiver request or confirm enrollment in the insurance plan, as the deadline is coming up. It's next week. And while insurance may seem complicated, and indeed we did go through a lot of terms and certain benefits today, know that Karen, Cynthia, and our other colleagues at the Student Health Insurance are here to help, and they're your one-stop shop for any questions you may have about your plan, about how to use it in conjunction with Columbia Health, either via the drop-in hours that they are hosting or by sending them an email at studentinsurance@columbia.edu.